So let's talk about what we should be telling our patients, because ocular supplements are clearly one of the most important things you can tell your macular degeneration patients. But there is confusion. So let's think about what they go through on the day of their diagnosis. They come into our office, they get all these tests done, and then they get the diagnosis of macular degeneration. They're overwhelmed. They're scared. They know people who have gone blind from this disease. There's usually family members inside the room with them, and they're concerned about what their role is. There's questions about safety of vitamins. We know that this link with zinc and other items and beta-carotene in smokers. And of course, there's compliance. One study showed that after 1 year, 40% of people stopped taking their macular degeneration. And this is really where our role comes in. There is reason for confusion, and this is why you should be specific with your patients. I went to a local CVS pharmacy and I took a photograph of the shelf that we send our patients to. And let's remember, these patients are usually older. They're not as sophisticated in all cases and understand what we told them. And so when you go to the CVS store shelf, you see one entire shelf of just lutein products by itself. And what's interesting is we talked that lutein probably is just not that effective without zeaxanthin. And then we have some of the other products. Bausch & Lomb has two lines of eye vitamins. One is the PreserVision line, and one is their Ocuvite line. There's an eye science product, which we'll talk about here in a bit. And then there's Alcon's products, which are eye caps, and they have, you can see, 1, 2, 3, 4 down at the bottom shelf. And then there's a couple generic brands as well. So clearly there is a reason for confusion by just sending our patients to the shelf without proper instructions. But what I found was interesting is actually going and looking at what's in these products. And I think you're going to all be surprised at what I found out. So Ocuvite, which most patients will come in and tell you, I'm on Ocuvite or on PreserVision. But we needed more information than that. I started telling my patients to bring me in the box. And the reason is because of a product like this. This is Ocuvite's product called 50 Plus. I'm not entirely sure what the idea was in this product. But as you can see, it has vitamin C. It has some vitamin E, it has a little zinc, and the level of vitamin C is very low. It's not AREDS quality. It's, I think, 150 milligrams, whereas AREDS is 150. It only has 1/10 of the vitamin E as AREDS. It only has about 9 milligrams of zinc, which is probably too low. And then it says lutein, 6 milligrams, but there's no zeaxanthin with it. And then it has a little omega-3. I'm not quite sure what this formula came from or where they had the science behind this formula, but this is the company that essentially owned the patent for AREDS and that changed this product. And this is probably a cheaper product on the store shelf and may lead to confusion at the store shelf. Then we have a product called Ocuvite with lutein. And lutein is a buzzword out there, so they think that they're getting the right product. Once again, vitamin C, very low, 1/10 of AREDS. Vitamin E, again, very low. Zinc, 15 milligrams, just not enough, and again, lutein by itself. So these two Ocuvite products by themselves really are not even AREDS-based products if you believe in the science of AREDS and you still want to do AREDS. AREDS, or Bausch & Lomb, does have an AREDS line in their PreserVision, and if you want, AREDS is great. But remember, once again, this contains vitamin A. Vitamin A is not effective in the eye in a pill form, and it doesn't have the lutein or the zeaxanthin, and it has the high level of zinc. And then there is a PreserVision with lutein. And so this probably sells well because the patients go there and they see PreserVision and they say lutein. But once again, vitamin C. So here's my problem with this product. It says serving size 1 soft gel. The vitamin C is half of AREDS. The vitamin E is half of AREDS at 200 international units. The zinc, it's lower, so I'm okay with that. But then it has lutein 5 milligrams. Once again, not nearly enough, and lutein by itself not effective without zeaxanthin. So that's my review of the Bausch & Lomb products. I'm a little frustrated that they had so many in their product line and that they chose to come up with formulas on their own outside of AREDS. Eye caps. Eye caps is another area of confusion. Eye caps does have an AREDS product, and it's strict to AREDS. If you believe, again, in AREDS, remember it has vitamin A, probably too much vitamin or too much zinc. Eye caps does have a product with lutein and zeaxanthin. And I'll tell you what's interesting about this product. So if you're a doctor who says, well, go out and get a product with lutein and zeaxanthin, this is the only one on the shelf outside of eye science that has lutein and zeaxanthin. But the problem is, when you look at the bottom of the label, it says lutein/zeaxanthin. and it only says 4 milligrams. It doesn't tell you the amount of zeaxanthine. And my guess is that zeaxanthine really is an expensive product, and we know that in the production of lutein, some zeaxanthin is made. So this is probably just a fractional amount, but once again, not a great product. And then there's an iCaps multivitamin formulation, which isn't bad, but really doesn't have the things that you need for eye health. It doesn't have the proper ratio of lutein to zeaxanthin. Let's talk about iScience. iScience is a new product that came out on the market last year, and this is a product that I really think has it all together. Let's look at their formula. Vitamin C, 500 milligrams. That is AREDS. Vitamin E is 400 milligrams. That is ARED. It does have vitamin B6 and folate, which we talked about, was shown in that study in February of 2009 to be preventative for macular degeneration. It has selenium. It has lutein and zeaxanthin in the proper ratio. 10 milligrams of lutein to 2 milligrams of zeaxanthin, 5-to-1. It is the only product right now on the mass market shelf, on the CVS shelf, that has this ratio. That's so important. It also has omega-3 in there. It has bilberry. It has alpha-lipoic acid. It has grapeseed extract, L-glutathione. So I think if you have the kitchen sink approach and you want everything that you need, iScience is a great formulation. In addition, I think iScience is great for those who don't have macular degeneration and are looking for a protective effect. This may be the right product for them. Or if you just want to be proactive in the early stages, great product. It's a product that I really feel is safer than anything else on the shelf right now. So as physicians, our job is, one, not only to point out the medicine or the product that can slow down the progression of this disease, but we have to improve compliance. If I said that there was a pill that would keep you from having a heart attack and you had a 1 in 4 chance of preventing a heart attack, 25% chance, you'd take it. And if I told you that pill was over the counter, you'd take it. Well, that's essentially what we have here. We have science that says that if you take an AREDS-based formula or an AREDS-2-based formula, you have a 1 in 4 chance of slowing down the progression of this disease. Pretty important. This is where our doctor's role is. We should be sampling the patients with the product we want. We should be naming products by name, because if you just say, go to the store shelf, get an eye vitamin, they're all the same, look for only AREDS, you're missing the boat, because AREDS doesn't have lutein and zeaxanthin. Also, it's helpful when products are accessible to patients. You know, some of these patients are elderly, they don't go to the store a lot. I think it's helpful when sometimes products are sold in your office, but if they're only sold in your office, it's probably not as helpful as being sold in the office and in the store. I always reassure the patients that, one, they can make a difference. Let them be proactive. Let them know that they control their destiny. And the one next note is cost. You know, vitamins are expensive, and this is something that's not covered by insurance. And so patients have a tough time. They think because it's not covered by insurance and it's not prescription, then maybe it's not as important as some of their other medicines which come from the pharmacist. You need to explain to them this would cost a lot more if it was if it was prescription, and this is something that they just need to bite the bullet and hopefully pay for to save their vision. And then lastly, as we know that healthcare is changing, there is a medical legal position here. You know, I think it is probably going to be considered malpractice if you don't mention in your notes or if you don't document that you told your patients about eye vitamins. The future is coming where it's paid for performance. This is something that Medicare is starting to do, where we have to tell diabetics that they have to control their blood sugar. We have to tell our AMD patients that they have to use AREDS, and it has to be on the chart once a year, at least in my field. So this is coming down the pipeline. When I was on faculty at Wills Eye, we did a survey looking at patient compliance and how to get them to better take their vitamins. And one of the things that we looked at was place of purchase. Do you buy them from the doctor's office? Do you get them at the internet? What would be the ideal situation? Direct purchase from your doctor's office? Where do they get follow-up purchases? What if it was internet only, and what if it was doctor's office only? And what was interesting in this study is that it showed that the best compliance came if the product was sold in the doctor's office and it was sold in retail. And this is really the model that iScience has followed. You can buy the product direct from the doctor, which gets you instant compliance immediately. It also enforces follow-up visits. It can be a revenue stream to the doctor involved, and it brings patients back to your office. But having the direct retail outlet also gives the product credibility, and it makes it easy for patients. I mean, clearly patients aren't coming to our offices every single month for follow-up visits in dry macular degeneration. So it's only sold out of your office. It may limit the amount they can take, or they'll have to buy 3 or 4 bottles to get them through, which brings into cost. So interesting, the direct-to-doctor and the direct-to-retail combined was the most effective model we found in improving patient compliance in our Will's Eye survey. So in conclusion, macular degeneration is clearly an epidemic, and it's on the rise. The people that we should be really concerning ourselves about are the 7.3 million in the early stages. This is where we have the most impact. It's where the role of prevention is important, vitamins like eye science and the ingredients that are preventative. 3.6 million have bilateral large drusen. These are the people who know they have macular degeneration and need improved compliance. Be specific with the vitamins that you want them to use. The 25 to 30% of family members that have the hereditary form, we should be talking to them about eye vitamins, the right choices, get their children on it if they're over the age of 45. We should all be talking to our patients about lifestyle modifications, quit smoking, watch your cholesterol. Medications like statins, Crestor, Lipitor have had a positive benefit on macular degeneration as well. And lastly, be proactive. We see patients all the time in our office who come in with a bleed in one eye, and they've never heard of macular degeneration, never have been told, have been seeing their eye doctor for years. I love it when my patients come in and they're already on an eye vitamin. It makes my conversation easier, and it helps with our relationship with our referring doctors. So you have nothing to lose. Start early as long as you choose the correct vitamin. And then lastly, let's talk about healthcare versus disease care. You know, we call ourselves healthcare practitioners, but really we wait till diseases get too far along and we treat disease care. The future of healthcare is really catching people early. Prevention is going to be a bigger key, and it's going to be where the focus of future healthcare dollars are. I thank you for your time and your interest in the subject, and I hope you enjoyed the presentation.